Hello guys, in this video we will discuss about the general surgery basics test and discussion questions we have posted in the WhatsApp group earlier. So first question, your professor asks you to prepare OT list. What is the sequence in the OT list you will follow? Four cases have been given here. So you should prioritize these cases according to their risk of infection. So you should always post first cases that have low risk of SSI, and the next cases you should post low risk to high risk. So who will help us to prioritize this? So Center for Disease Control guidelines will help us to categorize and prioritize these 4 surgeries here in this list. So before categorizing them into 4 categories, you should always ask some questions in our mind before categorizing them into 4 categories. So first thing is, any breach in sterility is there or not? And the next question we should ask, is there entry into either GI or genitourinary or hepatobiliary or oral cavity? Okay, even if you enter into these cavities, is there any inflammation is there or not? You should always think. And next question you should ask about yourself, is there any risk of spillage with feces or urine? Okay, is there any risk of spillage with feces or urine? You should always ask. And next thing you should ask, is there any pus? So based on these things, we will categorize the wound into clean wound, clean contaminated wound, contaminated wound, and the last is dirty or already infected wound. Okay, so if there is any breach in sterility, okay, so if there is no breach in sterility and you are not entering into the GI, genitourinary, hepatobiliary, oral cavity, and there is no inflammation or risk of spillage of feces or urine, and there is no pus, then this wound is class 1 wound, and that is clean wound. Okay, and if there is any minor breach in sterility, or you are entering into the GI tract, genitourinary tract, or hepatobiliary or oral cavity, but there is no inflammation and there is no risk of spillage with feces and there is no pus, so then we will categorize this as a class 2 wound. Okay, and the next category, if they even if you enter is there any breach in sterility? If the breach in sterility is a major breach, or is there any entry into the genitourinary tract, GI tract, hepatobiliary or oral cavity in the presence of inflammation, or even if you do the surgery and there is increased risk of spillage with feces or urine, then these will categorize the contaminated wound. So this contaminated wound is categorized to class 3. And remember, in contaminated wound there is no pus. So if pus is there, it doesn't matter about the rest of the 4 things. It doesn't matter. Okay, it doesn't matter about breach in sterility, entry into any hollow viscous tracts, inflammation is there or not, risk of spillage with feces is there or not, doesn't matter. If pus is there, then it is called dirty or infected wound. So if you come from up to down, the risk of infection will be higher. So here in class 1 lower, and in class 4 risk of infection will be higher. So coming back to the question, here the first option is given as laparoscopic cholecystectomy. In laparoscopic cholecystectomy, in this case they have given as option A. Here in laparoscopic cholecystectomy, we are entering into the hepatobiliary tract. So this comes under clean contaminated wound. So here information about the inflammation or infection, anything is not given. So we should classify this as a clean contaminated wound. So next option is open inguinal hernioplasty. In this surgery, we are not going to enter any of the hollow viscous tracts. There is no infection, there is no spillage. So we are going to categorize this as a clean wound. So next question is open hemorrhoidectomy. In this open hemorrhoidectomy, even if you just excise and resuture the wound area, but there is a risk of spillage with the feces. Okay, risk of spillage with the feces is there. So we should categorize this as the class 3 or contaminated wound. So last case is drainage of abscess. So here pus is there. So this is dirty wound. So if you prioritize this as per the CDC guidelines, so first case you should post as a clean case, next case should be clean contaminated case, next case should be contaminated case, and the last case should be dirty. So here the correct option will be B, A, C, D. So second option is the correct option. So let us move on to the next question. So which of the following measures are effective in preventing surgical site infection except? Even this question is based on CDC guidelines for SSI prevention. According to these guidelines, so you should always ask the patient to take bath or shower preoperatively, and ask to quit smoking, ask to maintain nutrition, adequate nutrition, and in hospital you should always give bath or shower with soap solution or any antiseptic. Okay, so next important things that will help you is prophylactic antibiotics. So based on the surgery we are going to do here, we should always give the appropriate antibiotics. So if you are planning for clean wound, there is no point of giving antibiotic. So studies have shown that if you give antibiotic in the clean wound or if you don't give the antibiotic in the clean wound, it doesn't matter. The risk of infection will always remain same, that is 1 to 2%. Okay, so you should not give antibiotics in clean surgery. Next, what about clean contaminated and dirty wounds? So in clean contaminated wounds, you can give antibiotic up not more than 24 hours of duration. Okay, and in the contaminated wound, you should give antibiotic in the full course antibiotic you should give for 5 days. And what about dirty wound? Here we should always give full course of antibiotic for 7 days at least. Okay, and what are the other measures that will help you to prevent the surgical site infection? The other measures are always you should maintain normothermia, that means avoid hypothermia. So you should always maintain body temperature more than 36 degrees centigrades. Okay, and next important thing is prevent hyperglycemia. So glucose level should be always 200 mg per deciliter. And one more important things that will help you is post-operative oxygen support. Okay, so there should be increased FiO2. Okay, so let us come to the options here. So first option is given as preoperative surgical site shaving. So we will discuss about this. So you should not do preoperative surgical site shaving. Why? Preoperative surgical site shaving will induce the microabrasions. Shaving will induce the microabrasions. In these microabrasions, there will be higher chance of bacterial colonization. So this will increase the risk of surgical site infection. Even if you want to remove the hair, use hair clippers. Okay, preferably on table. So this option is wrong option. Okay, next thing is prophylactic antibiotics. So prophylactic antibiotics we will give perioperative blood glucose less than 200 mg per deciliter. This is desired. So next option is maintaining perioperative core body temperature. This is also a correct option. So in the questions, if you see which of the following measures are effective in preventing surgical site infection except, so we have to choose the wrong option here, that is preoperative surgical site shaving. Please remember, you should not do preoperative surgical site shaving. So coming to the next question, you are going to operate a case of acute appendicitis. The empirical antibiotic therapy you are going to administer should cover. So we already discussed, you should always give prophylactic antibiotics. So these prophylactic antibiotics should based on local habitat. So if you see here in appendix is continuous with the large bowel. So appendix will contain same bacteria like colon. and cecum. So there are ample of bacteroids and E. coli, Klebsiella and other gram-negative bacteria inside the large bowel. So in the case of acute appendicitis, you are operating on the appendix, you should always give antibiotics covering the bacteroids and gram-negative bacteria. So coming to the options here, antibiotics should cover anaerobic and gram negative. This is a correct option. Gram negative and gram positive, wrong option. Gram positive and anaerobic, wrong option. Only gram negative is adequate, no. You should always add anaerobic to this patient. So next question, as per WHO safety checklist, which of the following is correct? Matching of the things to be done. So this question is based on WHO's surgical safety checklist. So WHO proposed some safety measures you should do before taking patient to OT and before giving any incision and shifting patient out. You should always check some things, and they are categorized into 3 levels. So first level will be before induction of the anesthesia. So this is termed as sign in. Okay, during sign in we should always check surgical site, consent, patient names, procedure, and check the functioning of the equipment. Is there any pulse oximeter is working or not, regarding the allergic conditions of the patient, and airway risk assessment and blood loss estimation. So in sign in, these all things you should do. So after sign in, if you're before giving the skin incision, you should always check some important things with the surgeon, with the anesthetist and the nursing staff. So here we are going to anticipate the some risks. Okay, and before that you should always know about each and every member of the team. So confirm all team members by knowing their names and their roles. Okay, name and role is very important. Okay, next thing, the surgeon should confirm name of the patient, procedure he is going to do on the patient, and where the incision will be made. Okay, and the nursing staff will tell you whether the antibiotic prophylaxis is given or not. Remember, to prevent surgical site infection, you should give antibiotic at least in the last 60 minutes. Okay, and the next thing, the risks you are going to anticipate. What are the risks you are going to anticipate? Here, is the surgery is going to be critical or not? Are you going to do any non-routine steps? Surgeons should address. Is there any prolonging of the case? You should address. Is there, what will be the estimated blood loss? You should tell. And to the anesthetist, they should always tell about the patient specific concerns. Okay, and nursing staff will give the ensurety of sterility in this step. So this phase is called time out. So remember, there is no time in surgical safety checklist. No timing. Okay, and next phase will be sign out. Sign out. So during sign out, you should always confirm with the nurse verbally whether they have checked the mop counts, they have confirmed the procedure and specimen labeling and all these things. Okay, and this sign out should be done before shifting the patient out of OT. Okay, so coming to the options, the first option is given as sign in to be done before giving the incision. So this is wrong option. Sign in should be done before giving induction. Okay, before giving induction. Next, sign out before shifting the patient out of operation theatre. This is correct option. Next option is timing before induction of anesthesia. So remember, already we have discussed, there is no timeout in surgical safety checklist. Sorry, there is no timing. I'm correcting myself. There is no timing. Okay, and the next option is timeout. Timeout is before shifting patient out of operation theatre. This is wrong. Timeout we do before giving incision. Okay, what is the answer here? Which of the following is the correct matching of the things to be done? So here this is the correct option. Sign out to be done before shifting the patient out of operation theatre. So next question is, identify the wrong match regarding setup of operation theatres. So the standard guidelines regarding the construction of OT complex have divided OT complex into 4 zones. So zone 1 will be the protective zone, and zone 2 will be the clean zone, zone 3 will be the sterile or aseptic zone, and zone 4 will be disposal zone. So from outer to innermost side, there should be protective zone in the outer side and disposal zone in the innermost side, and always there should be back exit from the disposal zone. Okay, this is entry and here it is exit. Okay, so in the protective zone there is reception area, dress change area for doctors and other medical staff. Okay, and nurse stations. Okay, and in the clean zone there will be doctor lounges or nursing lounges, pre-op and post-op patient care rooms, and in the sterile zone there is OT theatre, scrub area and OT equipment like machines like robotic machine, laparoscopic machine, all these things. And at the last disposal area, we should always dispose the surgical waste. So guys, coming back to the options. So first option is clean zone, contains preoperative and recovery area. So this is correct option. And next option is aseptic zone, scrub area is there. Yes, correct. This is correct option. And disposal zone, discard the surgical waste, and this is correct option. Protective zone, there is operative theatre. No, this is wrong option. So we have already seen in protective zone there is no OT. Protective zone is for reception and changing rooms and nursing stations, and here the OT is present in the aseptic area. So here the wrong option we should select is the fourth option. Okay, fourth option is the correct answer. So guys, these are the questions we have discussed. So for any doubts you can ask me on the YouTube group. Thank you.